I have been working in riding horses since I was 4 years old. So of course, I want to specialize in the equine area after I get out, hopefully. That's Casey. That's my new pony. She's super cute, and I love her. Okay. Oh, I gotta pop up my stuff. Went a little overboard. Vet techs can usually work in private clinics, laboratories, animal hospitals. There's tons of places around here that I know of. A lot of them work in private practices, like with your regular animal vets that come see your animals that don't really work in their own clinic. Their jobs can be physically and emotionally stressful and demanding. A lot of them can work double shifts, night shifts, holidays, weekends. Just like a regular nurse, we take care of the animals. So. The students will work with like companion animals, more dogs, cats, food animals like pigs, cows, horses, lab animals, and exotic animals. In a job, techs actually usually handle the animal first because we're the ones usually holding them or preparing them for the vet to actually come and do their work.
What is that?
It's a funnel.
What do they use it for?
Like if your dog gets fixed or something so they can't lift themselves. So you have to put a funnel around their head.
And they get so much cuter.
It's super funny. It's pretty funny to watch, actually. Okay. All right. Veterinary technologists and technicians must complete a post-secondary program in the vet technology program. Veterinary technicians do a 2-year course for an associate's degree, and veterinary technologists usually do a 4-year for a bachelor's degree. The graduated candidates will take the credentialing exams, which, sadly I already talked about everything. Both have to take the credentialing exam to become registered or licensed or certified, whichever one they're going for. Just depends which state you're going in. Essential qualities. That's my other pony. That's Tiana. Wow. 2 eyes? Yeah, 2 of them.
2 eyes?
2 eyes. They're both blue. Super cute. Anyways. They have to be a good communicator. Vet techs deal with, their coworkers, the animal owners, the veterinarians. So they have to be able to explain everything clearly to the owners and the vets. We have to handle a lot of stressful situations. If something's got to be put down, if something, is really ill, don't know if they'll make it through. I know I've had animals put down, and I would have felt bad for any vet that was around me at the time. We have to be detail-oriented. We have to know the animal's behavior, symptoms, be able to explain those thoroughly to the owners. If we see anything, tell the vets, tell the owners. And of course, you have to be an animal lover. That's key, I think. If you don't like animals, probably shouldn't work with them. Career options. Do private practices, like I said, just vets that actually work on their own, don't really go out of any real clinics or anything. Emergency, like animal hospitals. Specialty clinics, like if you want to go to an equine facility and work, a dog facility and work, you can go to kennels. Educational institutions, like working here. Research facilities and zoological parks. Sally wants to work. There's a few more, like the boarding kennels I talked about, pet rescues. You can go to the Humane Society and work, training facilities. There's tons of different options for a vet tech. Oh, there's a little kitty.
Can't hurt.
Our primary duties in a laboratory would be to collect blood, stool, urine, tissue samples for testing. We would perform lab tests, urinalysis, heartworm inspections, feline leukemia, blood counts. That's just most of them. and to take and develop x-rays. Okay. Surgical duties, sterilize instruments and equipment. That's just making it safest for the animal and us, of course. Assist in dental procedures, which is what this girl is doing. They're actually doing dental. Yeah, they have to pull the tongue out. They have this big contraction that holds the horse's mouth open and file. It's kind of funny because they dose up the horse with drugs. Oh yeah, it's funny. I had one try to run and it fell straight on its face.
That's hilarious.
It was entertaining. I had to pick him up. Oh, it was hilarious. We have to prepare the animal for surgery, sterilize any area that's going to be worked on, administer anesthesia, euthanize, which is the worst part, like Sally said. It's kind of sad. That's the part I'm mostly dreading is putting something down.
I don't care if a person dies.
Okay.
It's true. More sad to see animals die.
Primary duties for examination and treatment. Ask me important questions about the reason for the visit. You know, why are you here? How long has this been going on? Asking questions to get to know what we need to know about why this animal is having what's wrong with it. Record the history, weight, temperature, just like we go to the doctor and get our temperature taken or blood pressure or weight. We have to do the same thing for the animals. Restrain and stabilize the animals. Of course, before you do anything, they have to be laid down or, you know, in a certain position, staying there. Trim the nails, the normal stuff. Remove the can't even say that word, sutures or whatever it is, and perform other routine procedures. Administrator the medications, the vaccines, anesthetics. Provide the basic education. We have to make the owner aware of what's going on. Make sure if it does need any medication, we explain why the medication is being given, what it does, how often they should give it to them. Teach them how to administer the medications. Recommend products for optimal wellness, such as the vitamins, supplements. I know I take a lot of vitamins, and I do give my animals vitamins, so it's very good for them. Primary duties and office management. I think there's a picture. Yeah, pick a little puppy. Usually they maintain the records, billing of all the animals, just like anybody else would keep a client form, you know, client book. They do the same thing. Prepare and label the medications that need to be sent home. Organize the examination rooms, make sure everything's clean and sterilized. Restock all supplies, organize them, label them, make sure everything's in order for the next client that needs to bring their animal in. If you are working in a kennel or something, they would feed, walk, bathe the animals, take care of them, and also train your employees depending on how high up you are. Customer service and reception. That's pretty basic. Answer phones, schedule appointments, you know, greet the customers, be happy and upbeat with the customers, prepare their invoices, discharge the patients, and then follow up with clients, make sure everything's going well. If they need anything else. Oh, there's a piggy. I actually don't like pigs, but you know, they were kind of cute, so it's weird. Okay, job outlook. Mine's totally different than Sally's, so I don't know. You know, different places.
Mine's older.
Yeah, mine's from 2012 to 2022. It's the percent increase is 30%, which is still much higher than average. Average growth rate for almost all occupations is 11%, so 30% is pretty darn good. Employment will grow more as more veterinarians utilize technicians. More and more are starting to bring technicians in instead of using just regular assistants because technicians and technologists have more education, I think, about everything instead of just an assistant would be. Pay. Median annual wage in May of 2012 was $30,219. and then that is also $14.56 an hour. That's not starting off. That's just the average. The average vet tech can earn $9 to $18.25 an hour, and overtime can receive $14.50 to $29.25 an hour. Annually, you receive about $19,000 to $39,000, and a bonus can range from $98 to $2,000. The salary of a registered vet tech is usually around $10.75 to $23 an hour. Overtime can increase to $11 to $30 an hour, and the annual ranges from $22,000 to $50,000, and the bonus ranges from $74,000 to $2,000.